our teens, by middle age, it starts to pick up speed and go downhill fast. We're talking about diminishing hormones, aging. Our next guest says we now have better ways to restore the vitality we had in our younger years. Please welcome President and Medical Director of Biote Medical, Dr. Gary Donovitz, and hormone therapy patient, Daisy Onimus. Hello. How are you? Okay, so it is that natural process of aging, but we don't have to go crashing into it.
No, you don't have to go crashing. Actually, people's hormones start changing early, maybe the late 20s in women, in the 30s in men. They start losing testosterone. It's a real problem. Mood swings, no energy, not sleeping well, sex drive decreases, and weight gain.
Yeah.
Plus all the mood swings. And people get put on all these drugs they don't need to be put on.
Antidepressants, we'll put you on something to recirculate your sugars to get rid of the weight gain. And really, you're right, a lot of drugs that your body don't like and have side effects. And so if you can go back to what the natural, or what the issue is is diminishing hormones, so why not replace those hormones?
Well, we'll actually balance those hormones. So now your estrogen, your thyroid, and your testosterone are all in balance. That's why you age healthier, live happier, and you don't have to go through all these other drugs and wind up on antidepressants and all these fat diets and all these amphetamines. It's not good.
Well, there's medicating a symptom, and then there's actually taking care of the problem, right?
That's right.
What changed? All right, Daisy, what changed for you that you were noticing?
Well, I was having a lot of aches and pains and low libido and just feel a little depression and didn't want to take any of those other medicines or narcotics for all the aches and pains and the depression. So I heard about Dr. Donovitz and Dr. Frederick Brown and called them up. And I've had my second round of the pellet.
Yeah, and you say pellet, there's this little pellet here that's sitting here on the table. And Dr. Donovitz, in that pellet, it's put in under our skin, right?
It's all bioidentical. That's a testosterone pellet. It's painlessly placed in the hip, just under the skin. Doesn't hurt at all, and it lasts for 4 to 6 months. So you do it twice a year. If you need estrogen, we use estrogen also, and it's also bioidentical.
Yeah, and it's delivered in the body, so you're not taking a pill every day. And when you say bioidentical, that means your body knows what it is. It thinks you're producing it yourself. It matches exactly what the body produces.
Well, that's right. It's the same estradiol and the same testosterone that your body produced, no matter whether you're a female or if you're a male, the same testosterone. That way you don't have synthetic hormones, which come with a whole host of side effects. We've all heard about blood clots, heart attack, stroke, breast cancer. You don't have that with the bioidentical pellets.
Yeah, in fact, we were talking earlier about how the balancing of hormones is what can help you fight things like breast cancer. Okay, got to ask you, so you had the pellet put in. I see the smile on your face already. Okay, so how did things change?
Well, things changed a lot. Things were much better at home. My husband was very happy that I had this pellet put in, and I think my skin texture has changed. My energy level has improved. The foggy thinking is gone. There's no mood swings. Not that I had that many before, but you know, I'm just on a steady, even keel, and it is very nice.
Yeah, kind of that youthful feeling and youthful look. Okay, I want to mention real quickly, people may be looking at you going, isn't that the guy who's with Sotopelli, Texas? You are that same guy, but the name of the company has changed.
Yes, well, I bought the company, and we changed the name because we've actually taken it national. So many doctors and so many patients nationally wanted to be on this product. So in order to take it national, it didn't make sense to be Sotopelli, Texas in California or in Colorado and everywhere else. So we're in 15 states now, and we're able to deliver this and teach physicians how to do this, which is exciting for us.
Biote. Yeah, it's kind of interesting because a lot of people would say, well, isn't that the normal thing to do? But a lot of physicians have not learned about really balancing hormones as opposed to prescribing things to treat those symptoms. We have several people in the audience who have some questions for you. Let's start with Nina. Hi.
Hi, Deborah. 13 years ago, I had a hysterectomy, and they prescribed the hormone replacement therapy. But the side effect, I wouldn't take the pills. Is there any long-term effect of not taking hormones? Because I have thyroid problem, I had a mass, I had an adrenal gland removed. So there's days that I'm a little moody or no energy. So is there...
Interesting, she said I had thyroid problems. So thyroid is a hormone, but it's the non-balance of hormones that's causing some of these problems.
Well, that's correct. Once you've had your hysterectomy and your hormones are now out of balance, long-term effects, if you don't get your hormones balanced, you're not protecting your heart. Testosterone is the one hormone that protects your heart. It increases blood flow to your heart. It decreases plaque formations in the heart. It allows people's hearts to just age healthier, so you don't have the cardiac risk. It protects the brain from Alzheimer's. You decrease your risk of Alzheimer's by half. In men, if men have low testosterone, threefold increased risk in heart disease, Alzheimer's disease, and prostate cancer. So it's very important for both men and women to balance your hormones. The fact that you didn't do well on oral synthetic hormones is not surprising because of the side effects. There's 80 years of experience with these pellets. They're safe. You don't have the increased risk of blood clots, heart attack, or stroke, and in fact, no increased risk in breast cancer. Not one study, and they're used in 5 continents.
Yeah, it's interesting. People oftentimes will come up to me and say, so what are the side effects of bioidentical hormones? It's like, no, the side effects come when you don't have your hormones balanced. That's when the door kind of is wide open for all kinds of things to happen.
That's correct. I mean, the side effects from bioidentical hormone pellets are very minimal. Acne, 2% of people. A little bit of facial hair, 2%. You're going to get that anyway, and that's really your major side effects. People talk about hair loss. People lose hair when they're out of hormone balance. You have a baby, lose your hair. Have a hysterectomy, have your ovaries removed, hormones crash down, lose your hair. When you're in hormone balance is not when you lose your hair.
All right. So there's a physician referral email that we can go to.
Right. So what I thought I would do, lots of times we always give the website for where you guys can go, but other physicians want to know, and you want your physicians to know about this. So now you can actually refer your physicians at info@biotmedical.com, and we'll actually screen those physicians and offer this therapy to them, as well as what we'll offer to you guys later in this segment.
Yeah, and I can just tell you, when my thyroid went away after having my son, I was a crazy woman. I was depression, lots of weight gain, all kinds of things, and I was super, super tired, and that was just not normally me, and doctors wanted to give me all these medications to wake me up, something to put me to sleep, something to help me lose weight, which all would damage my liver, by the way, and so I finally found T3, T4, just regular thyroid, and I'm back.